Do you love coffee? But did you know that consuming it incorrectly can turn into serious problems for you? In this video, we will discuss 10 fatal mistakes that can destroy your health and send you to the hospital if you keep making them. We are sure that many of you are already making these mistakes, and if you watch to the end, you will learn how to correct them and enjoy your coffee without dangerous consequences. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Mistake 1. Overconsumption of caffeine is one of the most serious mistakes a person can make without realizing the potential consequences. Caffeine is a powerful central nervous system stimulant, and excessive consumption can lead to catastrophic health consequences, including arrhythmias, cardiac arrest, seizures, and even death. One of the most prominent examples is the case of a 24-year-old man from the UK who took a lethal dose of caffeine in an attempt to boost his energy before an important event. He drank 6 cans of energy drinks and several cups of strong coffee over the course of several hours. As a result, his heart stopped beating and he died on the spot. The case was scrutinized by medical experts who concluded that the caffeine overdose had caused him atrial fibrillation, a life-threatening heart rhythm disorder. No less terrible is the case of a girl from the United States who drank several cups of coffee in an attempt to stay awake before an exam. A few hours later, she began to have severe seizures caused by a caffeine overdose. Doctors determined that her body had been overloaded with caffeine, resulting in electrolyte imbalances and an overactive nervous system. Despite emergency medical attention, her condition remained critical for several days until her body was able to cope with the effects of the overdose. Scientific studies confirm that consuming more than 400 milligrams of caffeine per day can cause serious heart problems, especially in people who are already predisposed to cardiovascular disease. Caffeine can increase adrenaline levels in the blood, which leads to vasoconstriction and an increase in heart rate. This puts dangerous strain on the heart and can trigger a heart attack or stroke, even in young and healthy people. Many people don't realize that caffeine is not only found in coffee, but also in many other foods: energy drinks, black and green tea, chocolate, and some medications such as painkillers and weight loss drugs. Thus, a person can easily exceed the safe dose without even realizing it. In one study published in the journal Mayo Clinic Proceedings, doctors examined the effects of caffeine on a group of patients with cardiovascular disease. They found that patients who regularly consumed more than 400 milligrams of caffeine per day had twice the risk of arrhythmias and hypertension than those who limited their caffeine intake. In addition to cardiovascular problems, caffeine overdose can cause seizures, which is a result of its stimulating effects on the brain. In cases of severe overdose, the seizures can be so intense that the person loses consciousness and control of their body. This can lead to dangerous situations such as falls, head injuries, and even coma. It is important to note that even if a person does not drink a lethal dose of caffeine at one time, regular consumption of large doses can cause serious health damage. The gradual accumulation of caffeine in the body leads to chronic fatigue, irritability, insomnia, and anxiety disorders. As a result, a person gets into a vicious circle, trying to overcome fatigue with new doses of caffeine, which only exacerbates the problem. Mistake 2. Mixing coffee with energy drinks or stimulants is one of the most dangerous combinations that can lead to serious health consequences. Energy drinks and stimulants such as guarana, taurine, or ephedrine contain high doses of caffeine and other substances that enhance its effects. When these products are mixed with coffee, caffeine levels in the body increase many times over, posing a real risk of overdose. An example is the case of a 19-year-old athlete from the UK who drank several cans of energy drink and then added several more cups of coffee before a competition. As a result, he experienced tachycardia and a sharp rise in blood pressure, leading to hospitalization with a diagnosis of acute heart failure. Doctors detected high levels of caffeine in his blood. which turned out to be lethal. Fortunately, the young man was saved. But this case was an example of how easily a dangerous line can be crossed. A study published in the Journal of the American College of Cardiology shows that combining coffee with energy drinks increases the likelihood of hypertension and acute arrhythmias by 40% compared to pure caffeine consumption. This becomes especially dangerous for people with hypertension and latent cardiovascular disease. Additionally, a 2018 study by scientists from the University of South Australia found that the combination of coffee and energy drinks dramatically increases the risk of seizures. They found that this explosive cocktail activates receptors in the central nervous system, causing nervous overexcitement and even epileptic seizures in some people. For example, a case in the U.S. where a 23-year-old student began suffering from uncontrollable seizures due to regular consumption of coffee and energy drinks, resulting in nerve tissue damage and serious health problems. Cases like this emphasize the importance of a conscious approach to stimulant consumption. Many people think that the combination of coffee and energy drinks will give energy and vigor, but in practice, it leads to disastrous consequences. Mistake 3. Ignoring contraindications in cardiovascular disease. This is one of the most dangerous mistakes that can be made when drinking coffee. For people with chronic heart disease, such as hypertension, coronary heart disease, or arrhythmia, coffee can become a real threat to life. The fact is that the caffeine in coffee actively stimulates the cardiovascular system, increasing heart rate and blood pressure. Combined with pre-existing heart problems, this can be a trigger for myocardial infarction, stroke, or other acute cardiac events. Research published in the journal Circulation found that in people with cardiovascular disease, consuming more than 200 milligrams of caffeine a day, about 2 cups of coffee, can increase the risk of heart complications by 30%. One striking case involved a 56-year-old woman from the U.S. who suffered from hypertension. She drank up to 5 cups of coffee a day, despite doctors' warnings. One day during a busy day at work, she felt a sharp pain in her chest and lost consciousness. The doctors diagnosed a myocardial infarction, which developed against the background of high blood pressure and caffeine overdose. Another study conducted by scientists from Harvard University showed that people with arrhythmia, the risk of heart attacks increases significantly with regular coffee consumption. The study analyzed 2,500 people with chronic cardiovascular disease and found that frequent caffeine consumption increases the likelihood of stroke by 20%. For example, a 65-year-old man from Canada who suffered from arrhythmia was hospitalized after drinking several cups of strong espresso, which caused him to have a stroke. In addition, in 2020, the American Journal of Cardiology published an article analyzing data on the effects of coffee on blood pressure. As a result, it was found that in patients with already high blood pressure, even 1 cup of coffee can cause a jump in pressure by 10-15 millimeters of mercury column, which increases the risk of hypertensive crisis. In one such case, a 60-year-old man already suffering from hypertension was on the verge of life and death when, after several cups of coffee, he suffered a hypertensive crisis that nearly led to a stroke. It is important to realize that cardiovascular diseases require careful attitude to your health. Coffee, being a powerful stimulant, can be a trigger for severe complications. If you have heart problems, you should always consult your doctor before consuming beverages containing caffeine and should be taken in moderation. Mistake 4. Drinking coffee that is too hot is not just a habit, but a serious health risk that many people underestimate. Drinking coffee at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit, significantly increases the risk of esophageal cancer and other cancers of the digestive system. This threat has been confirmed by numerous studies that have shown a direct link between drinking very hot beverages and damage to esophageal tissue, which over time can lead to malignant neoplasms. In 2016, the International Agency for Research on Cancer, IARC, a division of the World Health Organization, listed drinking drinks that are too hot as a possible carcinogen. This decision was based on an analysis of more than 1,000 studies that demonstrated that regularly drinking beverages at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit, significantly increases the risk of esophageal cancer. In a study conducted in Iran where tea is traditionally drunk at very high temperatures, it was found that people who regularly drink very hot beverages have a 90% increased risk of esophageal cancer. One real-life case was documented in Turkey, where a 45-year-old man who was used to drinking coffee at about 70 degrees Celsius, 158 degrees Fahrenheit, began having trouble swallowing after a few years. After an examination, doctors diagnosed him with esophageal cancer, which developed due to years of exposure to hot beverages on the esophageal mucosa. This case caused a public outcry and prompted the medical community to actively discuss the effects of hot drinks on digestive health. Also worth mentioning is a study published in the journal Lancet Oncology, which analyzed the habits of more than 50,000 people from South American countries where hot drinks are popular. The study found that the risk of developing esophageal cancer was significantly higher in those who drank coffee or yerba mate at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit. Scientists note that constant exposure of the esophageal mucosa to high temperatures causes chronic microtrauma, which over time can lead to cell mutations and tumor formation. It is important to note that the problem does not only affect coffee, but also other hot beverages such as tea or hot chocolate. However, coffee, as one of the most popular drinks in the world, is often consumed by people on the go when they do not have time to cool it down to a safe temperature. Many people, especially those with busy schedules, prefer to drink their coffee immediately after it is brewed without waiting for it to cool down. This may seem like a minor detail, but the consequences can be serious. To prevent the risk, it is recommended that you always let the drink cool down to no more than 60 degrees Celsius, 140 degrees Fahrenheit, before you start drinking it. It may take a few minutes, but this time can greatly reduce the likelihood of developing dangerous diseases in the future. Mistake 5. Drinking coffee when you have a peptic ulcer or gastritis is an extremely dangerous practice that can lead to serious and sometimes fatal consequences. Coffee, having acidic properties and stimulating the production of stomach acid, can aggravate the symptoms of gastritis and peptic ulcer disease by increasing the irritation of the mucous membrane of the stomach and duodenum. When a person with peptic ulcer disease or gastritis continues to consume coffee, especially on an empty stomach, it can exacerbate the disease. In particular, coffee stimulates the production of hydrochloric acid, which increases the acidity of gastric juice and provokes further irritation and damage to gastric tissue. In severe cases, this can lead to ulcer perforation, a dangerous condition in which the stomach or intestinal wall ruptures, causing acute peritonitis. If the perforation is not diagnosed and treated immediately with surgery, it can be fatal. According to research published in the journal Gastroenterology, about 20% of people with peptic ulcers who continue to consume coffee experience a recurrence of the disease. In one case, described in the medical journal Case Reports in Gastroenterology, a man in his 50s with chronic gastritis repeatedly ignored doctors' recommendations and continued to drink several cups of coffee a day. As a result, he developed an acute exacerbation of his gastritis, which developed into an ulcer with subsequent perforation. This led to the need for emergency surgery and hospitalization in the intensive care unit. Doctors noted that his condition was directly related to prolonged coffee consumption against the background of gastritis. An equally important factor is that coffee can reduce the effectiveness of drugs that are prescribed to treat ulcers and gastritis, such as proton pump inhibitors. These drugs are designed to reduce the level of acidity in the stomach, but coffee, increasing the production of acid, can level their effect, which complicates treatment and lengthens the recovery period. Coffee can also aggravate the symptoms of reflux esophagitis, which often accompanies gastritis and peptic ulcers. Reflux occurs when stomach contents back up into the esophagus, causing a burning sensation, heartburn. The caffeine in coffee relaxes the lower esophageal sphincter, which allows acid and food to enter the esophagus, increasing the burning and pain. The risk of internal bleeding during an ulcer exacerbation is another major threat associated with coffee consumption. A study published in the Journal of Internal Medicine found that peptic ulcer patients who regularly consumed coffee had a 2.5 times higher risk of developing internal bleeding than those who gave up the beverage. Internal bleeding can manifest as vomiting blood or black tarry stools, both of which require immediate medical attention. Thus, people with peptic ulcer disease or gastritis should avoid drinking coffee, especially during periods of exacerbation. The health condition requires a cautious attitude towards food and drink, and unfortunately, coffee can be a catalyst for serious complications. Mistake 6. Consuming coffee during pregnancy in large doses is a serious mistake a mom-to-be can make, which can ultimately jeopardize both her health and the life of the fetus. Caffeine penetrates the placental barrier and directly affects the developing baby's body. Its effects can be especially dangerous in high doses when a pregnant woman's metabolism of caffeine slows down, leading to a buildup of the substance. According to a study published in the American Journal of Obstetrics and Gynecology, regular consumption of more than 200 milligrams of caffeine per day, that's about 2 cups of coffee, is associated with an increased risk of miscarriage and preterm labor. One large study from Denmark found that women who consumed more than 4 cups of coffee daily were 37% more likely to miscarry compared to those who avoided caffeine during pregnancy. The main problem is that the fetus's body cannot process caffeine efficiently because its liver and kidneys are still in the developmental stage. This causes caffeine to circulate in the fetus's blood much longer than in the mother's blood, which can cause cell damage, stunted growth, and problems with nervous system development. Moreover, caffeine affects the blood vessels of the placenta, which can impair blood flow and access to nutrients. A study published in the Journal of Maternal Fetal and Neonatal Medicine found that women who consumed more than 300 milligrams of caffeine per day had an increased risk of having a low birth weight baby. This condition can significantly increase the likelihood of various health problems in newborns, including immune system disorders and difficulty with thermoregulation. A real-life example may seem shocking, but it demonstrates how important it is to consider the amount of caffeine consumed. In 2018, a case was described in the UK where a woman who was used to regular coffee consumption continued to drink 4 to 5 cups a day during her pregnancy. Unfortunately, her baby was born prematurely with a number of complications related to underweight and developmental delays. Doctors noted that caffeine played a key role in the complications, making it difficult for the fetus to develop normally. In addition, studies show that high doses of caffeine can increase the risk of preeclampsia, a dangerous condition that is accompanied by high blood pressure and swelling. Consuming more than 300 milligrams of caffeine per day has also been linked to the development of gestational diabetes in some women, leading to additional pregnancy complications. Among other things, caffeine can negatively affect a pregnant woman's sleep quality, and lack of sleep and constant fatigue can exacerbate pregnancy complications and cause mental health issues. Studies show that chronic sleep deficiency in pregnant women can lead to depression and increased anxiety, which in turn affects the overall health of the mother and child. Thus, pregnant women are advised to strictly limit their caffeine intake or eliminate it completely from their diet to minimize the risk to themselves and the unborn child. Mistake 7. Abuse of coffee in glaucoma is a mistake that can seriously affect vision and aggravate the course of the disease. Glaucoma is a chronic disease characterized by increased intraocular pressure and can lead to vision loss if left unchecked. The caffeine in coffee can increase this pressure, making it dangerous for people with glaucoma. Studies conducted by scientists from Harvard Medical School have shown that caffeine consumption in doses exceeding 200 milligrams per day, that's about 2 cups of coffee, can increase intraocular pressure by 3 to 4 millimeters of mercury column within an hour of consumption. For a healthy person, this may not be critical, but for people with glaucoma, even such a small increase can accelerate the progression of the disease and affect vision. Coffee abuse is especially dangerous in the case of open-angle glaucoma, which is often asymptomatic in its early stages. Patients may not notice vision changes until damage to the optic nerve becomes severe. High intraocular pressure caused by caffeine can imperceptibly deteriorate the nerve and contribute to loss of peripheral vision. There is an interesting case study described in a medical journal. A 58-year-old man suffering from glaucoma was unaware of the effects of coffee on his vision and regularly drank 4 to 5 cups of coffee a day. Despite following medical advice and taking medication to control intraocular pressure, his condition worsened. After further investigations, it was found that his coffee habit was the main cause of his intraocular pressure spikes. Only after significantly reducing his coffee consumption did his condition stabilize and his vision loss slowed down. Another study published in the journal Investigative Ophthalmology and Visual Science showed that regular coffee consumption increases the risk of glaucoma in those who have a predisposition to this disease. Scientists analyzed data from more than 100,000 people and found that those who drank more than 3 cups of coffee a day had a 66% increased risk of developing glaucoma compared to those who drank no or moderate amounts of coffee. The same study found that coffee can negatively affect ocular blood flow by reducing oxygen and nutrients to the optic nerve, increasing its degeneration. This effect is particularly pronounced in people over the age of 50. Whose risk of developing glaucoma is already high. It is important to remember that glaucoma is a disease that requires constant monitoring and care. Even minor lifestyle changes, such as coffee abuse, can have a negative impact on vision. Therefore, people suffering from this disease are advised to minimize coffee consumption or give it up completely to reduce the risk of complications. Thus, moderate coffee consumption is an important aspect of eye health care for glaucoma patients. Mistake 8. Regularly drinking coffee on an empty stomach is one of the most common mistakes many coffee drinkers make. While this flavorful beverage is often thought of as a way to perk up in the morning, consuming it on an empty stomach can lead to serious gastrointestinal health consequences. Caffeine stimulates the production of stomach acid, which without food can have an aggressive effect on the gastric mucosa. When coffee enters the stomach on an empty stomach, it causes cells to produce more acid than necessary. This excess acid begins to erode the gastric mucosa, which normally protects the tissues from irritation. Studies have shown that regular consumption of coffee without food can cause gastritis, an inflammation of the mucous membrane of the stomach, which, if left untreated, can develop into an ulcer. A real-life case study published in the journal Gastroenterology is interesting. A 35-year-old woman, an office worker for several years, started the day with a cup of strong black coffee without breakfast. After a while, she began experiencing intermittent abdominal pain that worsened with each passing month. Her symptoms included heartburn, nausea, and upper abdominal pain. She eventually developed a stomach ulcer, which required treatment with acid-reducing drugs and a strict diet. Research also supports this risk. A paper published in the Journal of Clinical Gastroenterology found that people who regularly drink coffee on an empty stomach have a 30% increased risk of developing gastritis and peptic ulcers compared to those who drink coffee after meals. Scientists believe this effect is due to increased acidity as well as the effects of caffeine and other active ingredients in coffee on stomach cells. In addition, a study conducted at the University of Southern California showed that regular consumption of coffee without food increases the risk of developing acid reflux, GERD. This syndrome occurs when stomach acid backs up into the esophagus, causing burning and inflammation. In the long term, this can lead to the development of chronic inflammation and even precancerous conditions in the lower esophagus. A case described in the medical literature concerns a man of 45 years of age who began each day with 3 cups of coffee on an empty stomach. After several years of this habit, he developed severe gastritis and had to undergo an operation to remove the part of his stomach affected by erosions and ulcers. This case emphasizes that the abuse of coffee on an empty stomach can have fatal consequences. Moreover, coffee without food can have negative effects on the nervous system. People who drink coffee on an empty stomach are more likely to complain of anxiety, nervousness, and even tremors. This is because caffeine without food is absorbed more quickly into the bloodstream, causing a sharp increase in adrenaline and cortisol levels, stress hormones. This can lead to nervous disorders such as anxiety and panic attacks, especially in caffeine-sensitive people. Thus, regularly consuming coffee on an empty stomach poses serious health risks, especially for those who are already prone to stomach problems. The best way to minimize these risks is to consume coffee only after meals to protect the gastric mucosa and prevent serious complications. Mistake 9. Consuming coffee for chronic insomnia is one of those fatal mistakes that can slowly destroy a person's nervous system and mental health. Caffeine is a powerful stimulant that affects the central nervous system, increasing alertness and activity levels. However, for people who suffer from chronic insomnia, this effect can be devastating, causing serious neurological and mental health problems. When a person suffering from insomnia continues to consume coffee, they are caught in a vicious cycle. Caffeine causes arousal, which prevents normal sleep, and lack of sleep leads to an even greater desire to consume coffee to maintain energy. A study published in the Journal of Sleep Research found that regular coffee consumption in people with insomnia increases the risk of developing anxiety disorders by 30% and depression by 25%. Over time, constant stimulation of the nervous system leads to its exhaustion. One real-life case was described in the American Journal of Psychiatry. A young woman of 32 worked in a law firm and consumed up to 6 cups of coffee daily to cope with sleep deprivation due to chronic insomnia. For several years, she experienced nervous exhaustion, but continued to consume coffee despite clear signs that her mental health was deteriorating. Eventually, her anxiety disorders developed into severe depression that required hospitalization. Doctors note that excessive caffeine consumption exacerbated her condition and led to a nervous breakdown. Insomnia not only impairs cognitive functions such as attention, memory, and decision-making, but also affects a person's emotional state. Research conducted at Stanford University shows that people with chronic insomnia who continue to consume coffee are 40% more likely to experience symptoms of depression and 20% more likely to experience suicidal thoughts compared to those who give up caffeine. In addition to neurological effects, regular coffee consumption for insomnia can lead to physiological problems. Inadequate sleep disrupts the regulation of cortisol, the stress hormone, which leads to chronic fatigue and exhaustion. This, in turn, causes the body to seek additional sources of energy, provoking further coffee consumption and worsening the state of the nervous system. Researchers from Harvard University have found that people who regularly consume coffee in conditions of chronic insomnia are at greater risk of developing cardiovascular disease. Lack of sleep and constant nervous system arousal increase blood pressure and cortisol levels, which significantly increases the risk of heart attacks and strokes. Long-term consequences can include hypertension, heart failure, and other serious heart abnormalities. In real life, there are often stories of excessive coffee consumption leading to emotional exhaustion and depressive states. One such case is described in the clinical report of a British psychiatrist. A patient suffering from chronic insomnia experienced constant panic and anxiety attacks despite regular therapy. When she was found to be a heavy daily coffee drinker, caffeine withdrawal became a key element of her treatment. After 3 months without coffee, her condition improved significantly, her anxiety decreased, and her insomnia became less severe. Thus, drinking coffee for chronic insomnia can be a dangerous mistake that not only worsens insomnia, but also has a devastating effect on the nervous system, increasing the risk of depression, anxiety disorders, and even suicidal tendencies. Mistake 10. Combining coffee and alcohol is a hidden danger that is often underestimated. Many people believe that having a cup of strong coffee after drinking alcohol helps with alcohol intoxication, but this is a dangerous misconception. Instead of reducing the effects of alcohol, coffee only masks the symptoms, making the situation even more risky. Caffeine and alcohol act differently on the body. Caffeine is a stimulant that increases central nervous system activity, increases heart rate, and raises blood pressure. Alcohol, on the other hand, acts as a depressant, relaxing muscles and slowing brain function. When these two substances mix, the body receives conflicting signals, which can cause a number of negative effects. A 2016 study by scientists at Brown University found that coffee can mask the effects of alcohol intoxication, making a person feel more awake than they actually are. This creates the illusion of sobriety, which often leads to dangerous decisions such as drunk driving or continuing to drink alcohol until intoxication sets in. Statistics show that up to 50% of accidents involving drunk drivers are precisely because of the false sense of sobriety induced by caffeinated beverages. In addition, regular mixing of coffee and alcohol causes a serious blow to the liver. Alcohol itself is already a toxin to the liver, and its constant consumption can lead to the development of diseases such as fatty liver degeneration, hepatitis, and even cirrhosis. Caffeine, while not toxic to the liver in moderate amounts, when combined with alcohol, can increase the burden on this organ, impairing its regenerative abilities. Researchers from Harvard Medical School found that people who regularly mix coffee and alcohol have a 30% increased risk of developing liver disease compared to those who avoid the combination. One illustrative case is the story of a 28-year-old man from the U.S. who was hospitalized with acute alcohol intoxication after a party where he mixed alcohol with energy drinks containing caffeine. Doctors noted that the caffeine not only masked his intoxicated state, but also worsened his liver condition, requiring multiple days of hospital treatment. Another major concern is the effect on the cardiovascular system. The combination of coffee and alcohol can lead to sudden spikes in blood pressure and arrhythmias. This is because coffee stimulates the heart, while alcohol, on the other hand, slows down its rhythm. These opposite effects can cause heart rhythm disturbances and lead to life-threatening conditions such as ventricular fibrillation or cardiac arrest. One study published in the Journal of the American College of Cardiology found that people who regularly consumed coffee and alcohol together had a 20% increased risk of heart attack. Regularly combining coffee and alcohol can also trigger mental disorders such as anxiety, depression, and nervousness. Caffeine increases anxiety symptoms, and alcohol, in turn, disrupts the chemical balance of the brain by suppressing the production of serotonin. This leads to emotional instability and can contribute to the development of chronic mental health disorders. In 2017, the Mayo Clinic described the story of a patient suffering from chronic anxiety and depression who regularly mixed alcohol with caffeine-containing beverages. Her condition worsened significantly, requiring long-term treatment with psychotropic drugs. Thus, combining coffee and alcohol is a dangerous mistake that can lead to a host of negative health consequences, including liver damage, heart problems, and mental health problems. So, now that you've learned about the 10 fatal mistakes of drinking coffee, the question becomes, how do you drink coffee safely? It's all about moderation and the right approach. First, try to limit your coffee intake to 400 milligrams of caffeine per day. That's about 4 cups of regular coffee. If you have chronic conditions such as hypertension, glaucoma, or stomach problems, it's best to consult your doctor to determine your safe dose. Secondly, choose the right time for coffee. It is ideal to drink the first cup an hour after waking up and the last cup at least 6 hours before bedtime to avoid insomnia and overstimulation of the nervous system. Also, do not drink coffee on an empty stomach. It can irritate the gastric mucosa. It is better to drink it after breakfast or as a pleasant addition to lunch. Do not forget that the quality of coffee also matters. Give preference to fresh beans, avoid excessive amounts of sugar, artificial additives, and energy drinks. Remember that coffee can be your friend if you consume it wisely. Enjoy every cup, but don't let coffee jeopardize your health. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.